Are you suffering from sciatica right now? Are you dealing with pain behind your hip that goes down into your thigh? It might be a dull, achy pain, or sometimes it can be a sharp pain that radiates all the way to the back of the knee, the calf, even the foot and toes. My name is Dr. David and I'm a specialist physical therapist and I'm the owner of Paso Manual Physical Therapy. And at our clinic, we specialize in getting people suffering from sciatica back to being healthy, active, and mobile again while avoiding unnecessary surgery, relying on pain medications, and injections from the doctor's office. If you're looking to work with a specialist to resolve your sciatica problem for the long term, then I want to invite you to apply for a complimentary discovery visit with one of our specialist physical therapists. A discovery visit is a 20-minute appointment in person with one of our specialist physical therapists where they'll hear your story, feel certain parts of your body that help them give you a diagnosis for the root problem that's causing your sciatica issue. You can find the button nearby here to click through to the form to apply for a discovery visit. If you're looking to learn a bit more about sciatica first, let me give you the two most commonly asked questions here in our clinic and on our popular YouTube channel that has over 100,000 subscribers. The number one question is, does sciatica go away on its own? If this is your first or second time dealing with sciatica, it usually does go away on its own. For some people, it's just a few days, and for other people, it might be a few weeks. If you've had sciatica recurring over time, if this is your third, fourth, or 10th time dealing with sciatica, then it's probably more of a chronic issue, and that's a sign that you have some underlying root muscle imbalance that needs to be addressed so that this sciatica problem doesn't continue happening over and over again and worsening each time that it happens, as it commonly does. Usually it lasts for longer and it takes longer to go away and it becomes more intense, and it can be very concerning for people that have had sciatica over and over again and they don't know when to expect it. The second most commonly asked question is, what is the best way to relieve sciatica? Doing the right exercises at the right time combined with the right hands-on treatment is key to fixing that muscle imbalance, that root problem that's setting up the sciatica issue. Because sciatica is multiple body parts usually. It can be coming from the lower back, the hip bones, the hip joint, the knee. There's even contributions from the foot and the way that your foot muscles are supporting your joints. All of those factors need to be considered in order to solve sciatica problems for the long term. Getting help from a specialty trained physical therapist is by far the best way. And you got to be careful when shopping for a physical therapist because not all physical therapists are specialists in handling sciatica problem. Most physical therapists are excellent at handling people right after they've had surgery, but not as good at handling people before having surgery when they're looking to avoid having surgery. Any physical therapist will do the best they can with what they know, but if they're not seeing patients suffering from sciatica problems on a consistent basis and they're used to seeing people that have just had knee replacements or hip surgeries or back surgeries, then that's what they're going to be best at seeing. They're going to be best at helping people recover from surgery and get back to the simple things like walking. But curing sciatica for the long term is a whole specialty. Our clinic specializes in helping people solve the root problem of sciatica to get long-term improvements. You can see if it's right to work with us by applying for a complimentary discovery visit. Once you submit your information, after you hit that button, then one of my staff will receive that information and give you a phone call to begin to take you through the application process over the phone. I sincerely hope that you can get back to feeling normal again as quickly as possible.